What's going on, world? What is the deal? Hey. Wait, what is today? Today's Monday, right? Shit, I don't know. I already forgot what day it was. Hey, what's up? How y'all doing? Hopefully everybody had a really great weekend. I don't know, already forgot what day it was. I don't already forgot what day it was. Y'all already know what we're going to be doing here today. We're going to be doing NCLEX questions. So I'm glad that everybody is here. First of all, I hope everybody had a safe last couple of days, as well as you guys be safe, because it's finna get cold out this bitch, you know what I'm saying? So it's gonna get cold. So make sure you guys take care of yourselves. But you guys already know the deal. Hey, I need 1,000 likes. 1,000 likes, or we ain't going nowhere. Trust and believe me. I promise you, I will not do nothing until I get 1,000 likes. And I got to get 100 folks up in here. So hey, if you're new here, welcome. We're gonna do NCLEX questions. We do NCLEX questions every Monday, Wednesday, Friday, 5:30. Yeah, and I want to know who you are, where you're from, where you're at in your nursing journey. Yeah, what's up, y'all? How y'all doing? Miss Watt, I see you in there. I see you. You already know the deal. I will boycott this whole live stream. Try me, all right? But like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, so the whole goal is the more you guys participate, the more you guys smash that like button, the more you guys share, the more you guys follow, the more questions that you get. I'm just saying, don't come to this live and be greedy and take and don't give. Share it to people. Hey, if you're in school right now, share it to them as well. Hey, we got what? Hey, I got 155 people up in here. So what are we doing? What are we doing with the likes? We almost there though. We almost there. As soon as I see it, I'm gonna turn it around. And oh, look at that, y'all. Hey, I'm so proud of y'all. Hey, we already know what the deal is. We're going to be doing NCLEX questions today. I appreciate everybody being here. Hey, by the way, here's a little fruit for thought. If you don't like the fact that I talk too much, I don't care. So you can go to somebody else's live stream and not listen to them talk. So I'm just saying. But here we go, y'all. Here we go. Appreciate everybody rocking. We're about to get on to these questions. Here we go. Hey, question number 1. What is the primary reason for administering morphine to a client with myocardial infarction? Is it A, to sedate the patient, to decrease the patient's pain, to decrease the client's anxiety, and to decrease oxygen demand on the client's heart? What are we thinking? Shout out to almost 400 plus of y'all up in here? 400 plus of y'all up in here? Shout out to y'all. Make sure y'all keep smashing that like button. Make sure you guys share. Make sure you guys follow. That is the trifecta. That is the trifecta that TikTok needs and that I need. Don't come here and be so greedy. I promise you. Hey, we're at question number 1. By the time we get to question number 10, if I don't have 10,000 likes, I'm turning this live stream off. Y'all better ask somebody, because I'll do it. Don't come here and be greedy. Get carpal tunnel for me. I'm going to put you guys on a timer because y'all take too long. Also, hey, if you're new here, what are you what are you doing here? Like, let me know. I want to know who you are, where you're from, where you're at in your nursing journey. If anybody's taken NCLEX in the last, since the last time we did a live, let me know. Did you pass? Here we go. Here's our answer in 3, 2, and oops, I lied. And the answer is D, to decrease oxygen demand on the patient's heart. Morphine is administered because it decreases myocardial oxygen demand. Morphine to relieve pain during a MI has been used since the early 1900s. In 2005, an observational study raised some concerns, but there are very few ineffective alternatives. Morphine is a potent opiate. It decreases pain, which in turn leads to a decrease in activation of the autonomic nervous system. These are desirable effects when a patient is having an MI that is part of pharmacological and parenteral therapies. I failed 1 time. That's cool. I failed 3 times on the NCLEX, and I'm telling you, nobody cares. Nobody cares. Good question. Got it wrong. Thanks. Hey, what are we going to do? How are you going to fix it? How are you going to fix it, Wendy? How are we going to fix it? All right, here we go. Hey, shout out to everybody that got that question right. All right, here we go. Question number 2. Which of the following conditions is most commonly responsible for a myocardial infarction? Is it an aneurysm, heart failure, coronary artery thrombosis, or is it renal failure? Read rationales. Yep, you got to read the rationales. Ariel, it says, I was nervous about failing, but honestly having this live and studying helps. I'm glad, Ariel. I'm glad. See, I see familiar faces that come up in here. So everybody's telling me C. Oh, by the way, I got these questions off nurseslabs.com. I feel bad to retake my exam again. Why? Why do you feel bad about taking an exam that don't got a feeling of care about you? So how about you understand why you did not so well on that exam, right? Like, look at your performance breakdown and then go do it again. Get off your own beach. Get out of your own way. You see what I'm saying? It's I take my NCLEX in a month. I'm freaking out. That's cool, Elizabeth. You're going to freak out and you're going to be scared, but you're going to do it anyway. And if you're scared, and if you're really that scared, go to church. Here we go. And the answer is C, coronary artery thrombosis. Coronary artery thrombosis causes occlusion of the arteries leading to myocardial death. Myocardial infarction occurs when a coronary artery is so severely blocked that there is a significant reduction or break in the blood supply, causing damage or death to a portion of the myocardium. That is part of physiological adaptation, which is 11 to 17% on the NCLEX exam. 11 to 17%, which is the third largest section on the NCLEX exam. You should do a study for CNA exams. Why? Why should I do that? I'm a nurse. Why should I do that? Trust me, there's a bunch of things that I am going to be doing, but my main focus right now is just NCLEX. But trust me, we working on some stuff. Here we go. Question number 3. What supplemental medication is most frequently ordered in conjunction with furosemide? Is it chloride, digoxin, potassium, or sodium? Shout out to everybody in here rocking with me. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com. Hey, I know you're saying something about CNAs. Trust me, I know all about training CNAs. It's not like I haven't trained them before ever. You know what I mean? But I'm only one person working on building up a team so we can do other things. So we trust me, CNAs are not lost upon me. I used to be one. So I trust and believe me, I got you. Nurseslabs.com is where I got these questions from. OK, so if you guys want to go over there and check those out for yourself, you most surely can. All right. Cardiac services rotation on Friday. Shout out to you, Charlie. All right, here we go, y'all. Here's our answer. Here's our answer in 3, 2, and the answer is potassium. Supplemental potassium is given with furosemide because of the potassium loss that occurs as the result of this diuretic. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. Some other ones say 13 to 19%, but regardless, it is still the second largest section on the NCLEX exam. All right. So shout out to everybody that got that question right. Here we go. Question number 4. After myocardial infarction, serum glucose levels and free fatty acids are both increased. What type of physiological changes are these? Are these electrophysiologic? Are they hematologic, mechanical, or metabolic? All right. What are we thinking? A bunch of people screaming out D. All right. Screaming out D. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All I'm saying is by the time I get to question 10, I better have 10,000 likes, or I'm shutting the lab down, and you're just gonna have to stare at my face. But also, I want to know who you are, where you're from, where you're at in your nursing journey. Everybody's telling me you got some B's, got some C's. Tyler says, "Good luck, everyone." Shout out to you, Tyler. All right. Bridget says D. High school student getting my EKG certification and still thinking if I want to fully commit to nursing. Hey, you better think fast before high school is up. The last thing you want to do is be graduating and the next day you're just like, hey, what the fuck do I do with my life? I'm just letting you know I've been there. It says new grad and an SCI 6 months in. Shout out to you, Jimbo. And the answer is D. It is metabolic. Both glucose and fatty acids are metabolites. Oh my God. Whose levels increase after myocardial infarction. Acute myocardial infarction invokes a characteristic neurohumoral. Oh my God. Humoral. So it's neurohumoral response. Catecholamine release is increased. Plasma contents of fatty acids and glucose are elevated and glucose tolerance is diminished. That is part of physiological adaptation, which is what? The third largest section on the NCLEX exam at 11 to 17%. All right. And once you understand the categories and you can understand what question falls under which client need. And then you'll understand what subcategory and category they also fall under either. So I'm from Australia, but love your content. I love it. I don't know what your name is. What is that? A brown bear, but I appreciate you getting carpal tunnel for you. I appreciate you, Joy. Joy, were you the one who messaged me on Instagram? Here we go. Question number 5. Which of the following complications is indicated by a third heart sound, or S3? Is it ventricular dilation, systemic hypertension, aortic valve malfunction, or is it increased atrial contractions? What are we thinking? Somebody said I just had my first med-surg class today. Shout out to you, Matt. Shout out to you. Shout out to all 300 plus of you guys up in here, or in gals, or whatever you identify as. Welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Julia from Florida. I lived in Florida, Julia. I lived in Jacksonville. So shout out to Duval. Duval. Anybody in here from Duval County? Hope not. I know all about 103rd and Temecula. Don't be playing with me. So shout out to y'all. Give y'all 10 more seconds. What's up, Kate? I see you in there. I see you, Kate. Here we go, y'all. Here we go. Here's our answer. Here is our Duval's 1 hour from me in Georgia. Oh, you must be like in Kings Bay area. Do you do an NCLEX review program? Yes, V. I actually have an NCLEX review program. It's called the 7-day NCLEX course, and that link is in my bio. But the answer is A, ventricular dilation. Rapid filling of the ventricles cause vasodilation that is auscultated as S3. The third heart sound is a low frequency, brief vibration occurring in early diastole at the end of the rapid diastolic filling period of the right or left ventricle. That is part of physiological adaptation, which of course is what? It is the third largest section on the NCLEX exam at 11 to 17%. All right, cool. Didn't know this. That's okay. Hey, if you don't know it, this is why it's so great that you understand why you don't know it and why you go and you look at your rationales. That's the whole point of studying. People think, hey, oh, I could just do whatever I want. I could just go study. They're like, nah, bro, you got to come over here and put in this work. This shit ain't easy. So here we go. Hey, real quick, I have an NCLEX study guide. You know, because guess what? A lot of people are just like, oh, I'm scared to take this. I'm scared to do this. Hey, look, the path to conquering the NCLEX, it begins with you. Understand why you don't do things. Understand why you do things, why you don't do them right. And then you have to approve upon them. That's called an audit. It's called an audit. Bella, we don't go back. We don't go back, Bella. Sorry. Just like on NCLEX, once you answer your question, you can't go back. All right. Question number 6. After an anterior wall myocardial infarction, which of the following problems is indicated by auscultation of crackles in the lungs? Is it left-sided heart failure, pulmonic valve malfunction, right-sided heart failure, or tricuspid valve malfunction? What are we thinking? New grad and taking NCLEX next month. Shout out to you, Zane. Shout out to you. Got some C's. We got some A's. Hey, so I obviously know this answer, but tell me why you're picking your answers. I got some C's, I got some A's, I got some D's on this bitch. I got some B's up in here. Y'all know what the deal is. I'll keep smashing that like button. I appreciate y'all. By the way, if you're new here, we're doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. You guys can go over there and check them out for yourself. Make sure you guys keep smashing that like button. You guys share, you guys follow. Left equals lung. Okay, Dakota. Are you on Instagram? Shy, I am on Instagram. The Instagram is at the Boot Nurse, but I don't do Instagram lives because I only get like 5 or 6 people in there when I get 1,100 in here. So, better return on investment, I guess, and I reach more people over here. So here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer, of course, is left-sided heart failure. Okay, so the left ventricle is responsible for the most cardiac output. An anterior wall MI may result in a decrease in left ventricular function. When the left ventricle doesn't function properly, resulting in left-sided heart failure, fluid accumulates in the interstitial and alveolar spaces in the lungs and causes crackles. That is part of physiological adaptation. Third largest section on the NCLEX exam at 11 to 17%. Shout out to everybody that got that question right. Okay, somebody asked when I do these lives, Monday, Wednesday, Friday, 5:30 Central Standard Time, PM. If you ask me in the AM, you better be from a different country that asked me that. But y'all already know what the deal is. All right, Central Standard Time here in the good old US of A. All right. Question number 7, which of the following diagnostic tools is most commonly used to determine the location of myocardial damage? Is it a cardiac catheterization, cardiac enzymes, echocardiogram, or electrocardiogram? What are we thinking? Right equals swelling, left equals drowning. I like that. Is it Camilla? Camilla, I like that. All right, what are you guys thinking? Shout out to everybody. Shout out to everybody. Hey, y'all got me to 10,000 likes. I appreciate y'all. Hey, 20,000 likes. Keep getting the carpal tunnel for me. All right. Like I said, we got these questions off nurseslabs.com. You know what I'm saying? I don't gatekeep. Unlike Steve Harvey and Cedric the Entertainer, I'll let you know where I got my stuff from. Oh my God. Eric, I didn't ask you if it was easy. I just asked you to answer it. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is D, electrocardiogram. An ECG is the quickest, most accurate, and most widely used tool to determine the location of a myocardial infarction. That is part of reduction of risk potential. That boy good, Jimmy. That's what I'm talking about, man. But yeah, that is part of reduction of risk potential. Though a lot of people say that these questions are easy, but it's all about just getting into a routine of studying. Everybody knows that I'm here every other day, 5:30 Central Standard Time. If you get into the routine of doing something, aka studying, aka reading your question, your answers, your rationales, you'll be able to get yourself into a better routine when it comes to understanding NCLEX style questions and going to conquer your exam. All right, stop playing with me. Hey, 20,000 likes, make it happen. Question number 8, what is the first intervention for a client experiencing a myocardial infarction, right? So what is the very first thing that I want to do? Do I want to give them morphine? Do I want to give them oxygen, sublingual nitroglycerin, or obtain an ECG? What are we thinking? 8C. You mean C? I'm guessing you mean C. Mona. I don't know who Mona is, but I know what you're talking about. I don't know that Mona, but I know that Mona. You know what I'm saying? What are we thinking? I'll give you guys 10 more seconds. 10 more seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions for both RNs and LPNs. RNs and LPNs, by the way. All right, nurseslabs.com. You think it's B? Okay. All right, we're all kind of all over the place. That's okay though. That's why this is study sessions, baby. All right, here we go. Here's our answer in 3, 2, and the answer is A. I want to give oxygen. Administering supplemental oxygen to the client is the first priority of care. The myocardium is deprived of oxygen during an infarction, so additional oxygen is administered to assist in oxygenation and prevent further damage. That's part of physiological adaptation. ABCs. Think about Maslow's. You just asked me why. I just told you why. That's why I said read the rationales. Well, y'all probably can't read them all the way because I'm going to go really fast. But I just read the rationale to you, right? So it's like, what is the very first thing that I want to do? Think about ABCs. Think about ABC. Sometimes it's not as easy as 1, 2, 3. That's why it's important that you read your rationales, right? Important that you read your rationales. Okay. All right, here we go. Question number 9. What is the most appropriate nursing response to a myocardial infarction client who is fearful of dying? Now, based off of a lot of these quotes that are here, y'all tell me what type of question this is. Tell me about your feelings right now. When the doctor arrives, everything will be fine. This is a bad situation, but you'll feel better soon. Or please be assured we're doing everything we can to make sure you feel better. All right. So what are we thinking? Shout out to all 500 plus of you guys in here rocking with me. We're doing NCLEX style questions, NCLEX questions off nurseslabs.com. Nurseslabs.com. Did somebody just say, tell me more? Hey, I don't know what you want me to tell you, but I can't tell you anymore. Therapeutic, A, okay. All right, shout out to everybody. Definitely A, okay. All right, therapeutic type or technique, sorry. Definitely A. Okay, Paige, I see you. All right, what are we doing? What are we thinking? All right, A's, we got some D's out there. Throw some D's on it. All right, let's see what it is. Let's see what the answer is. Here we go, y'all. Here we go in 3, 2, and the answer is A. Tell me more about your feelings right now. Validation of the client's feelings is the most appropriate response. It gives the client a feeling of comfort and safety. That is part of the psychosocial integrity. 6 to 12%. 6 to 12% on the NCLEX exam, ladies and gentlemen. There you go. The comfort, 6 to 12%. Why would anyone choose D? Pat, you got to realize that there are people that are in here. There are people that are in here that aren't to the level of knowledge when it comes to nursing. There's some people in here that are in high school that have never even experienced this. You know what I'm saying? So sometimes they're guessing, sometimes they don't know. So we have to be very mindful of the audience that we have in here. You know what I mean? I'm not doing a lecture to where I would expect all of you guys to understand what I'm talking about. You know what I mean? It says, thank you for this, but I'm going to bed. All right, go to bed. Goodbye. Question number 10, which of the following classes of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? Are they beta blockers, calcium channel blockers, narcotics, or nitrates? What are we thinking? Who put E on there? What's wrong with you? What's wrong with you? Charlotte says A. All right, Charlotte, I see you. It was Charlotte. Hey, if you guys are new here, welcome. Y'all keep smashing that like button. Make sure you guys keep sharing. Make sure you guys follow. Hey, I need 20,000 likes. I need 20,000 likes. Make it happen. This is so helpful. Thank you. You're welcome. Please explain the one answer. Some of these answers I can't. I don't go into so much depth is because they take long to explain, and then most of the time you guys aren't like really paying attention. So, but that's why I said you get into the routine of reading the rationales. Okay, that is what I am trying to instill into you. I can't do everything for you. All right? And the answer is A, it's beta blockers. Now let's find out why it's beta blockers. Beta blockers work by blocking beta receptors in the myocardium, reducing the response of catecholamines and sympathetic nerve stimulation. They protect the myocardium, helping to reduce the risk of another infarction by decreasing the workload of the heart and decreasing myocardial oxygen demand. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. Is this a study guide? Where did you get it from? I got it from nurseslabs.com. All right. So this is why it is important for you to read your rationale. You're going to hear me keep saying it to you all the time. It says, do you have a layout about what percentage for each portion that it makes up? You can go to the ncsbn.org website, and they actually have it laid out for the NCLEX test plan, and you'll be able to see them in there. Okay. And that's where I got them from. Also, if you decide to buy my NCLEX course, which is the 7-day NCLEX course, which is this one right here, which is linked at the bottom, I actually go over and I tell you what sections are what comprises of what, computer adaptive testing. We go over, the 8 sections of the NCLEX client needs. There's the new generation NCLEX review in there, all that good stuff.